We're joined with Dr. Ittay Moreno, pediatric hospitalist at Las Palmas Medical Center, to talk about the common illnesses kids face this time of the year and how families can help keep them healthy. And good afternoon, thank you for joining us. And what are some of the common back-to-school illnesses you're seeing right now?
Hi, good afternoon. So the common back-to-school illnesses that we're seeing are most predominantly respiratory, your typical viruses that you see usually when kids come back and they start mingling, interacting with each other, so it increases the transmission of respiratory illnesses, as well as, stomach viruses, stomach illnesses that could get acquired when we return to school.
Those are some great points. And when should parents keep a child home instead of sending them to school?
A parent should keep a child at home instead of sending them to school when they see them symptomatic. Well, what are those symptoms to look for? So if they're having excessive cough, congestion, and definitely fever. A fever is defined as temperature greater than 38 degrees Celsius or 100.4 Fahrenheit.
What symptoms should parents watch out for that means it's something a little bit more serious?
If you find your child really working hard to breathe, definitely either go to your pediatrician or your closest pediatric ER. Also, if you find them that they're not able to tolerate any type of liquids, that is reflected when they're basically not urinating. Those are signs to look for your closest medical attention.
Yeah, definitely signs to look out for. And how can families boost their kids' immunity during this school year?
You're talking to a pediatrician, so it's always going to be vaccinations. You could encourage good hand hygiene, good sleep hygiene, and take your medications. If you're an asthmatic, make sure you take your controller medications, or basically all the medications that your pediatrician has you scheduled on.
That's great advice. And lastly, when it comes to parents, what are some things that they can take advantage of right now and take some action of helping to stop the spread of these illnesses?
Things that our parents can do is, hand hygiene, and if you notice that your child is sick and symptomatic, just keep them at home for about 24 to 48 hours before you send them back to school to decrease the risk of transmission.
Such great advice. Thank you so much, Doctor, for your time this afternoon, and we'll be right back after this short break. Stick with us.